Go.
Alright, here's a few techniques for patients with lateral elbow pain. A lot of good research is showing that not only can one of the causes be fibrous connective tissue around the lateral epicondyle, but it can be from a radial head dysfunction as well. So the radial head should definitely be assessed, mobility assessment, and should be treated. So here's a couple of the simplest techniques. The first, and this was described as something you should absolutely do. It apparently works on about 80% of patients with lateral elbow pain. And it's basically a Mulligan's technique. You first want to assess a movement that bothers the patient. So that primarily is either gripping or extending the wrist. And you assess those pain levels. Then you come in. You want to be just below the medial epicondyle, the elbow straight. You provide a lateral glide to the elbow, and as you do, then you ask the patient to repeat the painful motion. So I'd ask you to extend your wrist. Good. And relax. And you ask the patient if it's pain-free. You should adjust the glide, have them perform 10 repetitions, and maybe repeat 3 sets of 10. And just like that, a lateral glide. And you would extend and repeat like that. Simple enough. If that gets a little tiring, you can use a belt, and it basically works like this. You would put the belt around your shoulder. You internally rotate their arm so that you get the same lateral glide, and then you can use the belt, and this would have to be a little tighter, but you would use the belt to give a lateral glide like that. Now as you provide the lateral glide, you can even give a little bit of resistance here and have the patient repeat that extension. That's it. Pain-free, 10 repetitions, 3 sets. While you're there, if you find any limitations in extension or with the radial head, you can perform varus manipulation. So you bring them almost to full extension. They might be lacking a little. You want to basically be just below the medial epicondyle again. You're finding that barrier and you're giving a quick grade 5 thrust. Be right about here, like that. Okay? Good job. Then you can stand up. The last technique is another thrust manipulation for the radial head, and using the same Mills manipulation technique that we've seen. You can stand up, use your opposite elbow, stand that way. I want to keep my thumb on the radial head, giving a little posterior anterior pressure. Oftentimes the patient might have a little extension restriction, so I'll give a little AP pressure. Oh, there we go. I'll put them into that Mills position first. Relax. Little pressure here. You're finding the end range, and you're going to give a little thrust. Give those a try.